Our work at CSUL is driven by the aim to promote sustainable frameworks for cities and urban local bodies, frameworks that support the urban poor, women, and other vulnerable groups through enhanced livelihood and entrepreneurship opportunities, with a strong focus on intersectionality and gender inclusion. With that, allow me to briefly set the context for today's webinar. Urban informal workers constitute the very bedrock of our cities' economies. It's estimated that upwards of 80 to 90% of India's urban workforce operates with the informal sector. Think of this vast array of essential contributors, like domestic workers enabling others to participate in the formal workforce, gig and platform workers providing on demand services, care workers supporting families, transport operators keeping the city moving, sanitation and waste workers maintaining public health, and construction laborers providing and building our urban infrastructure. They are indispensable. Yet, despite their vital contributions, they often grapple with significant challenges like lack of formal recognition and representation, precarious working conditions, inadequate access to basic and essential services like water, sanitation, education, housing, often far away from work opportunities, limited social safety nets, and increasing vulnerability to climate change impacts. To mark Labor Day, which honors the historic struggles and ongoing contributions of the working class, we bring to you this webinar, City of Work, Planning for Sustainable Livelihoods. Our focus today is to center the voices, vulnerabilities, and aspirations of urban informal workers and explore how urban planning frameworks can be reimagined to support dignified and resilient livelihoods. This is the first in a new webinar series launched by CSUL at NIUA, which will convene experts, policymakers, practitioners, and grassroots leaders to deliberate on critical issues of urban poverty alleviation and sustainable livelihoods. Our hope is to foster knowledge exchange and co-create inclusive, actionable solutions for urban India. To commence our proceedings, it is my honor to invite Dr. Debolina Kundu, Director NIUA, to deliver the opening remarks. Dr. Kundu's leadership is vision are central to NIUA's commitment and addressing complex urban challenges, making her insights particularly valuable for today's discussion.
Thank you. A very good afternoon and a hearty welcome to Srimati Isha Kalia, Joint Secretary, Ministry of Housing and Urban Affairs, our esteemed panelist, and all of you who have joined us online today. It is my privilege to invite you to the first episode of the City of Work webinar series hosted by the Center for Sustainable Urban Livelihoods on the meaningful day of Labor Day, a moment where we collectively reaffirm the value of workers' rights and recognize their vital contributions in building our city economies. Urban areas, I think most of us are aware that it contributes to around 60% of the national GDP and act as employment generation hubs, especially for migrant rural populations. And it's at the forefront of sustainable livelihood questions in India. A large share of urban employment is also in the informal sector. According to the PLFS, around 80% of workers in urban India are informally employed. Moreover, the nature of urban work is evolving with the growing dominance of the service sector, the globalization and fragmentation of supply chains, and the transformative impacts of digital platforms. In this shifting landscape, it is essential to ask what role cities can and must play in promoting sustainable livelihoods. It is crucial to anchor this discussion in recognition of the fact that city systems cannot function without informal workers. I think we all are aware the hardships that we faced during the COVID period. The gig economy, for example, which is expected to employ 23.5 million workers in India by 2030, is the new normal through which urban transport, food, personalized care services are available and organized. The estimated 5 million sanitation workers in urban India are also crucial for public health and hygiene and maintaining sanitation infrastructure. Domestic workers play a vital role in easing the care responsibilities traditionally shouldered by women, thereby enabling their greater participation in the labor force. As informal workers continue to build and sustain our cities through their labor, it is time we shift the narrative and ask, how can our cities be designed to support and enhance the lives of informal workers? At NIUA, we are committed to bridging the gap between research and practice and working with city governments to implement transformative actions. It is with this intention that the Center for Sustainable Urban Livelihoods has been established to provide research, advocacy, and partnership support to the Ministry of Housing and Urban Affairs' two key missions on urban livelihoods, the National Urban Livelihood Mission and the PM Swanidhi Mission. I'm very happy to see the sector experts who have gathered here today, each bringing deep knowledge and expertise on the vulnerabilities and aspirations of specific groups of informal workers. I look forward to this discussion and to how it will weave together the sectoral insights into the domain question of informal workers. The opportunities are ripe for rethinking how city infrastructure planning policies and social security and labor protection can be reimagined in ways that are inclusive of informal livelihoods. On this note, I am pleased to welcome all of you to this webinar. I hope it marks the beginning of many more such meaningful engagements. Thank you once again for joining us.
Thank you, ma'am, for your kind words and continued motivation. Your leadership sets the tone for meaningful dialogue and impactful actions. Moving forward, I would like to invite Ms. Isha Kalia, ma'am, Joint Secretary, Ministry of Housing and Urban Affairs, to address the panelists and participants.
Good afternoon, everyone. I'm happy to be here and interacting with the experts and listening to all of you for the first time after I have joined NULM and Swanidhi as Joint Secretary. So I really look forward to be having a lot of ideas, coming out of today's panel discussions. So what I would be definitely interested in, because you all know that NULM scheme, the National Urban Livelihood Mission scheme, is in the process of restructuring. So we are in the process of, we've identified some vulnerable groups that we want to focus on to have a very focused approach to the entire mission. And all such vulnerable groups that you are discussing today, be it the gig workers, the transport workers, the domestic caregivers. So all these groups are part of our identified sections that we want to have targeted interventions for. Now, what I am looking when I was checking the structure of today's panel, so I see a very interesting mix of experts having expertise in different groups that we have identified. So what I would be looking forward for is practical ideas and insights, because what I realize and I feel is that we really need to think out of the box. Now, yes, self-help group approach is one part of it. Now we're also introducing the individual loan components into this for the vulnerable groups. How do we make it more relevant? What is the need of today's hour? And how do we actually reject the entire thing and start to think afresh and bring some freshness in the entire concept? Because what I realize is that there are a lot of interest subvention schemes that we are doing. Different ministries are doing it. We are also doing quite a few. For example, Swanidhi has seen so much of success. So how do we restructure our scheme in a way to make it much more relevant? It has a fresh appeal. And it is actually suiting the needs of people whom we are making it for. So my intention is, wherever I've worked in the field or whenever I've been in corporation or in the districts, that जो आपके beneficiaries हैं, उनका क्या say है, what do they want? We can't think on behalf of someone else. I feel that, till the time I myself speak to the gig workers, to the domestic caregivers, like I went that day to interact with a lot of street vendors in Delhi on what is their feel and, how how it has been for them. Have they availed the benefit of the scheme? Was it easy? Did they feel some difficulties? And somehow, the impact on the ground, the feedback from ground is something that really makes and breaks a scheme. So what I would want, because we are in this opportune time that we're in the process of restructuring, it's not that something has come out and we're working backwards. Let us have some fresh ideas so that actually it is meeting the needs of people for whom we have made the entire effort. And through you, I would be, because I realize that some of you are representing the gig workers, some of them are the domestic caregivers and all. So I would request that, what is the thing that they want? Because if you're representing that section, what is it that they're looking for in a scheme? Is it just a loan, or is it the capacity building aspect, hand holding support? The processes should be easy and simple. How do we reach out to them? Because these are the people who are, for them, every day matters. They're working for their living every day. So, doing a long-term capacity building doesn't work for them. The courses have to be, very crisp, short, relevant. The paperwork cannot be bulky. Everything has to be online, digital, and very much, again, a very short format, not many details to be fed into the systems for no use. So everything from the beginning till the end, how do you visualize it? How do you, give us the ideas that we can incorporate in this scheme is something that I'm looking forward in today's discussion. And even after this discussion, surely we'll be in touch. But my intent, because presently I'm in that middle and thick of my thinking, and every day I'm spending a lot of time thinking on how we can make things that we don't see that, it's the same thing that's been rolled out again. It needs to, because times are changing so fast. The needs are changing so fast. The aspirations of people are really different. So therefore, it's very important that we actually capture those aspirations. And the, such dynamic world we're living today, we really have to keep up the pace. And all such sectors, for example, gig workers, if I talk, it's such a relevant sector today. And on its own, it's been running, it's providing a livelihood to so many people. And people are making such a good living out of it. And I've interacted with so many of them, and they say that, yes, at least we get a assured, clientele. For example, like marketing for SAGs is a big issue. Like SAGs are doing such great work, but at times marketing linkages is something we really need to strengthen for them. We need to have give them exposure into the online platform so that they can sell their things. We need to, now the concept of the marts is coming, that there'll be dedicated marts in the city so that they can showcase their products, they can sell it there. But so therefore we have to be different in our approach. We really need to think, and that would only originate from what those people and those categories want. So therefore, I think I would not want to talk much, because today I want to be more in a listening mode, when I actually listen to what are the real aspirations of people on the ground through you. And then we'll definitely have separate interactions. I'll also meet all the stakeholders, because that we're also running pilot in 25 cities. And we've got a lot of feedback from various groups. And most of you'll be surprised that, maximum identification, socioeconomic profiling presently has happened in the domestic sector. So therefore, we got some feedback, relevant feedback from the cities and state officials when I interacted with them last week. So now I was thinking that, we need to interact and hear some experts before we directly reach out to the stakeholders for their feedback, before we roll out something and bring it in public discussion as a document. So that will be all from my side, and wishing you all the best and looking forward for a meaningful and engaging, insightful session. Thank you.
Thank you, ma'am, for your support and your words of strength. Your guidance is instrumental in driving the mission of inclusive urban development. On this note, I am delighted to invite Dr. Mukta Nayak to moderate today's session. Dr. Nayak is the policy lead for CSUL, trained as an architect and urban planner. Dr. Nayak is a public policy researcher focusing on urban housing, livelihoods, and internal migration.
Thank you, Abhisheka, and welcome to you all again. And thank you, Isha ma'am, for setting a wonderful context, because I was going to start today's discussion with Aishwarya Raman who represents the gig workers on today's panel. Briefly, Aishwarya is the Executive Director of OMI Foundation Trust, and she leads a team of researchers and policy professionals who work with union and state governments on energy, mobility, livelihoods, and technology transitions. For this first round of discussion, we actually wanted to focus on, we all know that the workers we're talking about, have this label of informality on them, and we always talk about what does it mean to be an informal worker. But moving beyond that, what are the specific needs and aspirations of these workers from the cities that they work in? So this was the specific pointed question that I wanted to ask all our panelists, and especially starting with Aishwarya, and with a focus on transport workers, so delivery workers and those working in the ride-hailing services. If you could talk a little bit about the conditions they face, the challenges they face in urban environments.
Thank you. Thank you so much. And thank you, NIUA, for having me on this webinar. To quickly respond to a comment Isha ma'am had raised, I'd like to say that, yes, ma'am, I think, skilling, market linkages, access to finance, so individual new age workers can become asset owners are all in the need of the hour. And like Dr. Nayak mentioned, I'm going to limit my response to this question to urban planning challenges, needs, and aspirations of gig and platform workers. Let's begin with a grounded understanding of platform-based mobility workers. At the OMI Foundation, we've conducted some of India's largest and earliest platform economy studies. One primary survey was with over 5,000 gig workers across urban India, focusing on ride-hailing drivers, bike taxi operators, and delivery partners. Our research shows us that many gig workers are first-generation urban earners, often transitioning from informal or unstable livelihoods. For most, the platform economy represents a pathway to urban inclusion, offering flexibility, higher and more regular income, and dignity in work. However, urban planning is yet to catch up with the platform and gig economy. While the nature of work has changed, urban planning frameworks have not yet evolved to meet the spatial, infrastructural, and accessibility needs of platform-based workers. Workers navigate, as we all know, long hours on the road, but lack safe and accessible rest areas, secure parking spaces, dedicated mobility lanes or zones, access to toilets, water, and basic facilities during their numerous shifts. And again, we've got to remember that platform or gig workers could be part-time or full-time individuals. Their workplaces at the end of the day are the streets, the cities themselves, which are dynamic, mobile, and public. To complicate matters, climate-induced stressors like extreme heat, poor air quality, and sudden flooding directly impact mobility-based platform workers who spend prolonged hours outdoors. While traditional planning frameworks have largely focused on static office-based workspaces, it's encouraging to see the Ministry of Housing and Urban Affairs and the National Institute of Urban Affairs taking steps in the right direction to build more inclusive, worker-responsive urban infrastructure. So through our study, what did we learn from our workers? We learned that they require, and there is an urgent need for rest infrastructure. This includes safe, shaded spaces to pause, recharge, eat between tasks, designated pickup and drop-off points, particularly in crowded areas to avoid traffic fines and other forms of penalties, access to charging points. As you would all know, several states are mandating that shared mobility platforms become all electric at the earliest, if not on day one. This means that electric vehicles that are owned by these gig and platform workers require dedicated access to charging points for continued running through the day. Traffic and parking reforms also, so that gig workers and gig workforce is well integrated with your municipal level mobility plans, as well as in offering first and last mile connectivity solutions to public transport. Before I hand it back to you, Dr. Nayak, I'll spend just a minute to talk about gendered and inclusive planning, to specifically focus on the needs and aspirations of women and workers with disabilities in the mobility-based platform economy. We at the OMI Foundation also conducted an extensive study on women in the platform economy, wherein we interviewed over 600 women workers across the country. Our study shows that women deeply value flexibility and autonomy of platform work. However, safety in public spaces is a major barrier. They therefore need well-lit roads, surveillance-supported transit zones, and safe waiting areas. Childcare spaces near gig hubs would also support greater participation. This is above and beyond the common demands across genders, that of accessible and functional toilets, rest areas, charging facilities, and so on. Persons with disabilities alike require universally accessible public infrastructure. We would all have experienced several workers with disabilities delivering goods to us, and that's going to become a mainstream avenue and a mainstream economic livelihood opportunity for persons with disabilities as well. So to integrate them, it is going to be our responsibility to create inclusive cities. And we all know that cities are the engines of growth. And I look forward to also discussing some of the solutions I have in mind to ensure that gig and platform workers are well integrated in our cities.
Thank you so very much, Aishwarya. I'll move to Dr. Janhavi Andharia, who is Director of the Institute of Social Studies Trust. And she has over 30 years of experience working on gender issues, especially on gender-sensitive governance, promoting women and livelihoods in security and disaster response. Janhavi, I wanted to talk to you about care. Care has been a central issue in the narratives of women, especially from the low-income communities, as a barrier for them being able to join the workforce. And there's also the issue of care being an opportunity for livelihoods. So if you could speak to a little bit to what care workers and what care presents as an opportunity for urban livelihoods and what's going on there, because I know that ISST has been doing a lot of research on the current models.
Thank you so much, Mukta, for this opportunity, and to CSUL for inviting me and to share our thoughts. And I think Dr. Isha has really set the tone quite well, that to really be contemporary. We need to move forward, and we need to think maybe out of the box to really, be actually responsive to the needs. With regard to care, I think what we all kind of have known, because we have the TOS coming out quite regularly, and I think the newspaper headlines always catches that. But to just kind of state that in the context of what is really this need, I would like to spend maybe half a minute on the data. The care time that women spend is 130 minutes in a day, whereas men spend only 75 minutes. And the unpaid domestic work, women spend 289 staggering minutes a day, and men spend 88 minutes a day. So if men spend a little over an hour, and if you put both of them together, about 2 hours. But if you look at what the women are spending, and if you add that, it's really a huge amount of almost 5 to 6 hours a day that women are spending on care. And it arises out of the socialized norms that are there, where women have been socialized into believing that this is their life, this is what they have been born to do, and only if they are able to successfully fulfill these norms can they think of earning. Again, for earning, let's look at the data of the labor force participation. We have known about the U-shaped curve of women's participation when we look at vis-a-vis income. Those households where the incomes are really low, women do not have a choice but have to step out and go out to earn. As the income starts increasing, women are expected to stay back in the house, look after the care responsibilities. And as again the family income goes up, when you do have some money to share to higher domestic work, then women are again able to step out and participate, and then that work gets counted as labor force participation in an economy. So we need to recognize that care is gendered, and it is a class component out there, that while all women have to do care work, some women are able to outsource it to other and we're going to have Geetha talk to us about the domestic work and what that kind of means. So what one really needs to be doing is to unpack this care. And ISST, we have been doing this for almost 4.5 decades now, because in fact it was ISST who did the first time use study way back in the early 70s, and on the government picked it up, and now we have it more regularly. And I think this whole understanding of care, especially in a country like India or in the global south, what we have understood is not only about children, because our families, we have elderly, we have people with disabilities, and therefore care includes a care of different kinds of people in the family that need to be looked after. Two, we still do not have all our basic needs fulfilled. So for instance, we still have women who have to stand in queues to fill water, and water is essential for all care responsibilities, cooking, hygiene. The fuel requirements are met by multiple sources of fuel when you talk about the large number of low income women working. So they will, if you see, they will use the twigs they collect to heat the water, but maybe they will use a gas for the cooking. So there is a mix of fuel, and getting access to this fuel, maybe it's standing in queues or collecting these fuels, is also part of care responsibilities, which is often not measured by the Western economists, because there the system and the economy involved at a certain level. And we need to take care of these kind of times, which is recorded in the minutes that the TUS does. And so care, therefore, is a much broader concept, and not only about looking after children. It is, much broader. And what we have learned through our various studies that we have done, and more notably the compendium that we did, which was actually, I think there are many more models in the country, but our compendium, we did it just over the COVID period. We were able to document about 30 various, such models, where different organizations, because they were talking or they were wanting to work with women, realized that unless and until they provide care services, they cannot do a good health program for women, they cannot do a livelihood program for women, or they cannot do, a vocational center for women. So they actually, a lot of them started running care services because women's time otherwise was just not available to do the program. Something, Mukta, that you were saying, that, we may have skilling programs, but if women cannot even, come for that because they are occupied, you're going to have a challenge. So that's something that we learned. And second, what we learned was that a one size fits all model does not work, because women's needs and women's working patterns are very different. For instance, the gig workers, they are going to be if they are in the mobility or even in the beauty sector, they are going to be having to move around. So where is it that they will like to leave their child? Is it near the family or the habitat where they are staying? Or is it close to a cluster where their large number of their work is going to take place? You have women who are working in shifts, the hospital workers. You have a whole lot of women in hospitals. They are again working in shifts. What time and when do they need care for their children? This is kind of very, very different. And again, domestic workers, I'm sure, Geetha will tell us that lot of the time domestic workers pick up tasks or jobs such that they're able to go and drop the child, they're able to pick up the child, and so that they get breaks in between. And so how do you, design care services has to be based on the kind of work that women are doing. I mean, one of the models that we studied was about sex workers. They need care at very different hours because it is a work for them. How do you imagine, where the children should be at night when they're supposed to be sleeping? So their needs are going to be very different. And finally, we'll have to come to the fact that how do you provide care for different class categories of women? Because the understanding of, who can pay for what kind of services, what are the aspirations, that has to be seriously taken into consideration. Having said that, I think all women will like to have good, hygienic, basic, high quality services, and that cannot be compromised, saying that poor women can do with poor services. We have to be committed to giving very high quality, good, because at the end of the day, it is also about the children and their growth, their needs that need to be fulfilled. I'll kind of stop here for this round and hand it back to you, Mukta. Thank you.
Thank you so much. I'll move to Geetha Nambisan, who is director of Jagori right now. Jagori is a feminist research and advocacy organization that actually had its roots in women's unions and collectives. So I think, Isha ma'am, this is an organization that is seeking really from the experience of a lot of women's unions around Delhi and the country. So I'd request Geetha to talk a little bit from a study that they recently did, which was a survey of domestic workers and which had components around mobility, care, and other kind of urban infrastructure. So I'll hand it over to you now.
Thank you, Dr. Nayak. This is a great opportunity for Jagori to be presenting, to be talking about our recent study, which focuses on the challenges that domestic workers address as they navigate care, mobility, safety, and other concerns. So this study was conducted in Delhi NCR with about 270 women. So this actually reflects the voices of 270 women. And the idea was to understand key challenges with respect to care responsibilities for domestic workers in their own homes. Janhavi has referred to this a few times already. And thank you, Janhavi, for already, highlighting some of the things that I would have talked about. Secondly, to understand the safety issues that they confront. And lastly, also to talk about the working conditions of the women domestic workers. So this survey covered about 11 locations in Delhi, and it was also supplemented with a women's safety audits in 4 locations of Delhi NCR. So I'll just briefly talk about what the study found. It revealed actually, what it did was to reveal the complex of temporal, spatial, and societal constraints that shape the daily decisions of women domestic workers about their work locations, commuting routes, working hours, and all of this ultimately impacting their economic opportunities and their well-being. So first of all, one of the things that we found was about the unpaid care work that women domestic workers do. It was found that 60.1% of the respondents said that this occupation gave them enough time to focus on what they see as their primary duty of familial caregiving. Now, this Janhavi has already mentioned, but the idea, I think the point here is, they consider this to be their primary duty. So an overwhelming majority of women domestic workers actually face the dual burden of professional work and personal care responsibilities, particularly in childcare, elder care, home management, and so on, including access to water, sanitation, and all the challenges that come with the locality where they live, the services that they have access to, and so on and so forth. So in nuclear families, 66% of women domestic workers actually engage in unpaid care work, whereas in joint families, they found 73% women domestic workers perform care work at homes. More than 53% of the workers reported that their unpaid care responsibilities directly interfere with their ability to pursue work opportunities. And 63% believe that they could increase their paid work hours if the care burden was reduced. On the other hand, there is the whole question of valuation of domestic labor. 57% reported a monthly average personal income of about 7,500 rupees, way below the stipulated minimum wage, currently at 18,000 and more for unskilled workers. Then we come to the simple issues of transport. Simple but complex, I would say, because it really feeds into this whole complex of the women's access to their workplaces. So mobility patterns of women domestic workers in Delhi NCR significantly influence their access to employment opportunities and advancement. So by understanding their transport choices, the associated costs, and daily commuting challenges, you get insights into how this influences their access to employment opportunities and advancement. 79% of the respondents said they commute to work on foot. This was largely owing to the fact that that they could not afford public transport. Other factors that hinder access to public transport are availability and safety, leading to higher investment of physical effort and time cost. Workers constantly are balancing between cost, convenience, and time in their day-to-day commuting decisions. There's always a trade-off, and it's seen that sometimes when a women domestic worker has to choose, she would rather undertake a risky walk home than dip into her earnings for a bus ride or walk an extra 25 minutes on a relatively safer route. The safety audits that Jagori conducted also revealed an average time of 30 to 45 minutes to walk the distance to the first place of work, which means that even if they have a break in between, they cannot go back home for lunch or rest. They have to eat on the roadside, in the park, and stay out even during extreme weather conditions. Like the summer now, there is so much concern about the heat, and we really don't know where the domestic workers are going to sit during lunchtime or break hours. Sometimes the longer walks, we found during our discussions that the longer walk sometimes takes them through rough shortcuts with high risks of incidents, accidents, unhygienic environments, and sexual harassment. That brings us to the point of safety. So one of the things was that sexual harassment is a big concern for domestic workers, both along the way, especially along the way, a route to their place of work. And this actually causes them to decide to go either in groups or to choose a different route, or even, and in extreme cases, to choose a different employment. Lack of designated footpaths and walk paths sometimes make them, supposing the, from their place of residence to the main road, the lack of a proper footpath may cause people to choose shortcuts. In Taimur Nagar, for example, we found that the only way to reach the main road was to negotiate an open polluted canal, a garbage dump, a railway line, a clump of high bushes, and a wall, and climb that wall. A route that is chosen on account of saving 20 to 25 minutes. Poor maintenance of roads, lack of traffic control, designated pedestrian crossings, all lead to accidents. There is also the concern of dysfunctional street lighting, inadequate lighting in parks. So this actually makes it impossible for the women to walk home after dark, and therefore they have to choose their times of work such that they get back home, say by 5 p.m. or so. Inadequate security measures such as police booths, police stations, patrolling. These are also big concerns. Guards at community centers and parks. These are all things that prevent the access of the women domestic workers to their workplaces. Thus, we see that the kind of the complex of time, of care work, of not having enough public choices for public transport, not having safety on the route. It's a whole complex of conditions that need to be addressed. I hope I've not taken too long. Thank you, Dr. Naik, for this opportunity once again.
Thank you. No, I think you brought up a whole bunch of, a whole set of problems related to urban infrastructure, which we've been talking about, but it, linked it really to domestic work, and thank you very much for that. I'll move to Rituraj next. Rituraj Pegu is an urban researcher. He works in the Climate Justice and Urban Informal Economy project in Delhi with Viego. Um, he's also the coordinator of the Delhi Roundtable on Solid Waste Management. And Rituraj, so as the coordinator of the Delhi Roundtable on Waste Management, you work with waste workers, and these are, some of the most poor and marginalized communities in the city. And you work with them directly, and I've attended, events in which many workers have spoken. So I'd like you to tell us, in their voices, how do they talk about the challenges they face from the city in terms of infrastructure, services, amenities?
Thank you for the introduction, and thank you, Mukta. And I'm really pleased to be a part of this important conversation today. And many of the issues highlighted so far by our esteemed speakers, I think it resonates strongly with what we are seeing in the waste sector too, with informal waste pickers. So, in fact, waste pickers face a very similar set of overlapping vulnerabilities. And so I would like to build on those insights and bring in a few grounded dimensions from the field. So what I want to emphasize today is that when we talk about the informal sector, we are really missing the very specific day-to-day challenges these workers face in our cities. So, and actually, I want to start, by pointing out something that's always struck, I guess, to all of us as a fundamental contradiction in our cities. So basically, when we look at, when we struggle tremendously with with waste management, and yet there is, almost no recognition of the contribution waste pickers make to keep the cities functioning. So the basic needs are completely overlooked, firstly, from our urban planning systems or say infrastructure development, and they are sort of invisible to the system despite being so visible on our streets every day. So first, let's talk about the infrastructure challenges, workspace infrastructure. So which is something we rarely consider for informal workers, as we know. So this workspace deficit is again getting worse as cities are evolving, cities are developing. So spaces of decentralized, say, sorting are closed down, and infrastructure at existing sites are also in very deplorable conditions. So no basic amenities, no safety provisions. So many of these waste pickers again are then they're forced to use their own homes as sorting sites. So basically homes as sites of segregation, which again turning their lives living spaces into workspace with all the associated health risks. But I also want to just imagine sorting through all the mixed waste, because we know that segregation is not happening at the household level. So without even access to running water to wash your hands after handling so much of potentially hazardous materials, chemicals, toxins, and others. So, and there are no toilets nearby for an say 8 to 10 hour workday. So no toilets, no shelter or shade from the sun, or during rains. So this is their daily reality. So it's not just occasionally it's happening, but every single day of their working lives. So the health risks are again very severe and cumulative. Why I'm saying cumulative is because most of these waste workers we interact with have suffered multiple injuries from sharp objects like glass, metal, medical waste, and others, and they regularly handle this toxic materials with bare hands, because again PPE, gloves is either unavailable for them or it's unaffordable. So we have documented so many case studies, cases of chronic respiratory problems, skin conditions, skin infections, and musculoskeletal injuries, which from lifting heavy loads of waste. So and here is the thing, so they have almost no access to healthcare that sort of addresses this very, very specific occupational hazards. And added to that, another aspect is the mobility challenge that we rarely discuss. So waste pickers, they travel across the city like for long distances daily, and they rely completely on public transportation to access their workspaces. So what happens is this again affects their time, income, and safety. So why this is again particularly unfair in many cases is because the cost of this transportation is entirely borne by the waste picker themselves, which further eats into their already less earning incomes. So, and then there is added to this is climate stressors, climate extremities. Another major challenge that's becoming worse, more severe: heat waves, floods, urban floods, then air pollution. So this disproportionately sort of affect waste workers who work outdoors without any climate resilient infrastructures. So apart from this, I also want to highlight something that's often gets overlooked, which is the gender challenges specifically in this sector. So there are so many women waste pickers in this sector, and they faced additional vulnerabilities, lack of sanitation facilities, harassment in public spaces. There's significant wage gaps, and even greater sort of invisibility for their overall contribution. So we also need to, talk about this, overall exclusion, institutional exclusion, this informal workers face. So many waste pickers have lived in the same city, specifically if we talk about Delhi. They have lived in the city for so many decades and sometimes for generations, but still don't have the basic, documentation that, sort of recognizes them as legitimate workers. So without this recognition, we know they can't access financial services, no bank account, no loans to like, sort of improve their or expand their work, and they can't access any social security benefits. So these are some of the issues, and we can't, sort of separate their work conditions from their living conditions. That's again another vulnerability. So it's all interconnected. So most waste pickers we know live in informal settlements without basic services themselves. Their homes, as I said earlier, often double as storage for spaces, because there's nowhere else to keep the materials of which they sort, right? So they face sort of a double exclusion, both at work and at home. This entire process again, further reinforces their marginalization. But when we talk to waste pickers across cities in India, they are not just complaining about these issues or challenges. They have very, very clear aspirations, or say a vision, as in how urban systems could work better. They want recognition as service providers who are reducing waste going to landfills, or say they have a huge major contribution. They have a major contribution to reduction of greenhouse gas emissions and also to the circular economy. So we have to keep that in mind. So they want the right to waste, firstly, as legitimate economic actors, and want to be recognized as co-creators in the entire waste management systems. And that's really, I think, which it comes down to creating systems, urban systems that work for everyone who contributes to them, not just in formal employments. So I'll pause here because there's so much to unpack, and I know that we have other panelists from different sectors who bring their own expertise to this conversation. But just I want to say that this is not a one-time dialogue. These are again ongoing urgent questions, and how we can build more inclusive cities, sustainable cities, climate resilient cities that work for everyone. Thank you.
Thank you so much, Rituraj. And I completely agree. They're ongoing. We're here to listen to each other and build also linkages with what we're all saying. I'll bring in Dr. Harshil Sharma towards now as the last speaker, last panelist, and then we can go for a second round after that. Harshil is a labor economist and is currently working as Director Government Relations at Indus Action. I think he's previously worked on the government side of things and seen things quite closely. So Harshil, for you, since you work a lot with the construction sector, and this is one group of workers which has sort of a dedicated board and assess and some sort of a clear social welfare framework. There's also been a recent slew of measures that the Delhi CM, I think, announced around informal workers in generally, but also with a focus on construction workers. And yet there are segments that are unaddressed, especially NACA workers, workers who are not so migrant or seasonal, but spend a lot more time in the city. So since we're looking at this from a planning and from a city infrastructure perspective, could you just speak a little bit to that segment, to those segments that are not so well addressed by the BOCW framework?
Sure. Thank you, Dr. Naik, and thank you to other participants for the enlightening discussion. Maybe I'll begin by what Isha actually wanted us to begin with. Like if I'm representing the construction workers here, chosen to represent them. So I'll begin with 4-5 majority of issues that workers face on ground. I am currently working in Indus Action. We did a survey around October last year in Delhi, where with the construction workers, where we asked, and it was around time of Diwali and Chhat Puja. People, for context, in North, these are the most prime time where workers go back to their native states from where they have come to celebrate these festivals with their loved ones. So many workers who are working, we asked them specifically, why are you still working? Why are you not going back? Is your family in Delhi? Or they were migrant laborers. The reason why they have not gone back was they were not, by their ठेकेदार or their subcontractor did not allow them to go back at that time. And the reason was they said पिछले and quote unquote कि पिछले 5-6 सालों से 10-15 दिन में बैन होने ही वाला है, कंस्ट्रक्शन एक्टिविटीज बैन होने वाली है, तो तब चले जाना, अभी त्योहार के टाइम जाने की जरूरत नहीं है. So this is the actual level of resistance, I would say, or not resistance, resilience that this market has already made in place, that at the time of festivals, workers cannot go back. But when the workers don't, for no fault of theirs, actually have to go back when their livelihood is just taken away from them just because of some activity ban. So beginning from that, maybe I'll just share 1-2 numbers. Mukta, it would be okay if I can share my screen. I'll just take 2-3 minutes to just share some numbers. For the construction sector, I'll just throw 3 big numbers. As Mukta said, this compared to other sectors which were really enlightening to be discussed here. Construction sector is different because it has an act, it has money to give to the construction workers. So that's why it's a bit different from other sectors. Putting into context, we have 5.65 already registered workers. This is a way in which construction is different from maybe a gig workers or a domestic workers, where we don't actually know how many workers are there. So estimated around 7.1 crore workers, but 5.65 have been registered across BOCW boards. There's tentative estimations that by 2030, there are going to be around 10 crore workers working in the building and other construction sector. There is around 65,000 CR of total BOCW says, for the context, there is a BOCW Act 1996. Every construction that happens across India, 1% of that amount is deposited as cess, which is to be used for welfare of construction workers. Around 60% of that total amount collected still remains unspent. So with my experience working with the government, within and outside the government, this sector is suffering not from that policy is designed well and it's suffering because of lack of implementation, but it is suffering because of lack of verification to know who is a construction worker and who is not, which is why this amount remains unspent. There are too many problems to be shared for the construction sector. I'll just focus on one problem which I highlighted about these construction bans due to heat wave, cold wave, and air pollution. So this is just one problem I'll want to focus on. That India loses around 34 million work days annually due to these heat stress. There's a study conducted by CII. I'm quoting their numbers. As Mukta said, major of the labor chalk workers largely remain invisible. They are not registered. The numbers I showed earlier, these workers are not able to register, not able to prove that they are construction workers. They're actually not able to get into the system so that they can be given some welfare benefits from the state. So to the problem of this heat wave ban or an air pollution ban, state actually reacts. It's not that state does not react, but the react is mostly a knee-jerk reaction where there are construction bans. Support only comes to construction workers after some Supreme Court orders or a directive issued by NGT or Supreme Court. There are many heat action plans that exist. MCD level municipal corporations have those plans, but there is lack of implementation. Supposedly, right now, CM of Delhi has actually instructed that there will be no construction activity happening in the peak hours of heat, maybe between the time period of 12 to 3 or 4. So at those time periods, the work doesn't happen. Workers are made to function. They are actually functioning. What we get to know, the implementation of these guidelines, or I would say directives, is remains very limited because of lack of machinery. I won't blame the state for it, but actually the private class for it, because state does not have that much machinery to actually make them function. The payments that go to these workers, these are actually, they don't go to all the workers. As I said, verification remains a big issue. For instance, there are tentatively around 10 lakh construction workers in Delhi, but when the air pollution ban happened in Delhi, just around 1 lakh of them got this ex gratia money. So, looking into the spirit of what can be a good solution, one of the plausible solution is parametric insurance. You should have automatic payout whenever the temperature rises or falls below a certain degree. For instance, if the temperature is above 46 degrees, or maybe temperature is below 2 degree, or even if the AQI level is above 450, at these three, and these benchmarks can be discussed, but there should be some sort of a payment made to the construction worker, because they cannot function in such harsh climatic conditions. We don't need any manual verification for it. It can be a very quick way where we can function and actually do this parametric insurance. There have been pilots that have happened of this parametric insurance. Seva, for instance, has done some pilot. 2-3 private players, one of another organization, Jansas, they've also done a pilot of it. So this looks like a plausible solution to handle this problem, but a mass level implementation of this is still remaining. The premiums to be paid for these parametric insurances can be done by the funds that I mentioned from the boards, but still, I would say a long way to go how we reach towards that. I would say state of Uttar Pradesh is keenly looking towards this solution. Even our organization, Indus Action, is pitching it to Delhi and other northern states, and let's see if we get uptake for it. Not coming to all problems, but one thing that should be implemented and across these urban spaces is there needs to be labor sheds, there need to be water dispensers at all these labor chalks. When we ask these things to the state, the first thing that comes back to us is they don't have list of how many labor chalks are there. We did this exercise for Delhi. There are around 246 labor chalks, but many of these urban cities or urban places don't even have the list of how many labor chalks are there. So this planning of how the data of knowing where my workers is actually important to actually plan to give them any sort of welfare measures. So what can be other plausible solutions to some other problems? Maybe I can take in next round of questions. Yeah, thank you so much.
Thank you. Thank you so much. We have about 20 minutes left and there are lots of interactions. I'm going to break from our original script a little bit and make some of the comments in. Actually, Mahesh Kajera has picked up exactly this question of हमारे शहरी प्रवासी श्रमिकों की संख्या या मैपिंग करने की व्यवस्था नहीं है, तब तक पब्लिक इंफ्रास्ट्रक्चर पर हमेशा लोड पड़ेगा. So just in response to what Harshil has said, and I think maybe a future idea for a webinar or another kind of a discussion would be specifically on challenges with enumeration, spatial mapping, and so on and so forth, because in some cities maybe ahead of others, and that could be a positive way to take forward these discussions. And I will also weave in Sahil Sasidharan's point here as I come back to all of the panelists one by one about the interlinks between, the different groups that we're talking about. So he's talking about, how, for example, the dependency of gig workers on domestic workers on street, on informal workers, on street vendors, and these kind of sort of interdependencies. So maybe I can start with Aishwarya again and do a quick round of solutions. And as I switch between panelists, I'll try and bring in some of the other comments. Aishwarya,
thank you
want
so
to go
much,
first?
Dr. Nayak again, and such insightful inputs from all the panelists. And I was also keenly looking to try to respond to Mr. Sahil's question as I present some of the solutions I have in mind. So it's, of course, well established that there's a need to rethink cities for a new workforce, such as the gig and platform economy workforce. Why the platform economy is not merely the it's not merely peripheral to urban development. It's a core enabler of our everyday urban living. Urban mobility workers, be they riders, drivers, delivery partners, need to be seen as critical urban service providers, much like sanitation or utility workers. Planning cities with their needs in mind doesn't just support them, it improves urban functioning, economic productivity, and citizen convenience. In this regard, I humbly submit 6 urban planning interventions for platform mobility workers. And this, of course, speaks to some of the needs and aspirations of several other categories of workers we've discussed so far. One, worker-centric public infrastructure. Developing gig mobility nodes, and these could also be your labor chokes that are undergoing a transformation in the future, designated at hubs in high demand zones such as markets, transit interchanges, IT parks, etc. This is where some interaction with street vendors is also facilitated. Incorporated with resting spaces, toilets, EV and phone charging points, parking bays, and co-locating such hubs within existing urban commons, such as your metro stations, bus stops, municipal markets, and so on. Second, looking at smart zoning and last mile integration. For mobility-based platform workers specifically, this is of relevance. Integrating gig workers into urban mobility plans, your comprehensive mobility plans, non-motorized transport plans, street vending zones with clear space allocation, designating pickup and drop-off zones or bays near malls, offices, residential societies to reduce traffic disruption and penalization. Third, looking at digital physical infrastructure synergy. Partnering with platforms is so important. I know we briefly touched upon the question of data and enumeration previously, but we could, in the context of the platform economy, especially tap into the data that platform businesses themselves have to create real-time app-based data exchange on demand clusters. This can inform your infrastructure siting, traffic flow improvements, dynamic parking solutions, and so on. Fourth, looking at inclusive EV infrastructure planning, ensuring that EV charging stations under state EV policies are worker-friendly. Fifth, looking at gender and accessibility lens also as we plan our urban areas, building safe and inclusive public infrastructure. We've already discussed street lighting, CCTV monitored zones, but ensuring that this is not paternalistic and intervention for our women workers, but they're truly empowering. And also exploring the creation of certain women-only safe rest spaces as they also take care of their caregiving duties in these locations. Universal design, of course, for persons with disabilities, sanitary facilities with menstrual hygiene infrastructure, and lastly, gender sensitization of all public-facing personnel, including other platform workers, traffic personnel, toll booth operators, etc. And lastly, climate adaptive urban design. As cities face the realities of climate change, planning for platform workers must include heat resilient zones, shaded transit corridors, and climate adaptive urban design. Just 2 additional points, Mukta. I know our previous speakers also spoke, especially especially Rituraj, mentioned how we need to have these as recurring conversations, especially with all the stakeholders. We could explore under the NIUA and MoHUA, explore the creation of multi-stakeholder tripartite partnerships, taking the shape of urban livelihood councils in several of your leading Tier 1, Tier 2 cities, and of course, expanding across the country. These councils could have representation from city authorities, planning departments, platform companies, and worker associations or gig unions themselves. Ultimately, I think we've got to design cities that can truly contribute to building a Viksit Bharat where growth is inclusive, infrastructure is people-centric, and every worker has a rightful place in their urban future. So with that, I hand it back to you.
Thank you so much. I think you all answered a lot of questions. I think Saleha, some of your questions being already answered by Aishwarya. So I'll move to Janhavi with this. Saleha has also brought up the point of home-based work opportunities for women. So I'd like you to fold that in, if you can, with the question of care and livelihood. How do we think of care as livelihood, care as with livelihoods that can go with care responsibilities, as you discuss the solutions that you've prepared, if you could also address those questions.
Yeah. Thanks. And yeah, I think so. First of all, I think whether women want to work in the home or outside should actually not be based on predictated by their care responsibilities. I think this should be a choice. Most of us who are perhaps here, who have been able to, been privileged enough to be able to step out to study, to, have jobs, we have certain arrangements. We are privileged enough so that we can make these choices. A lot of the women often do not have this choice. So I think the first and foremost, it should be the choice of every woman to be able to decide where then how they want to work, whether they, I mean, and it's okay if some women don't want to work outside and want to be at home, that's also their choice. But I think what we are trying to say is that care often puts a structural barrier which is not even seen. It's just assumed as it is their duty. So I think that's something that we need to first be mindful of before we say that because they have to do care, let's give them livelihoods in their homes. I think we need to ask ourselves, would we, trade for that? That, okay, I can, do everyday work from home. How many of us would trade for that? Maybe some of us will. But is that something that should become the norm? So assuming that they can look after the children, because even working from home requires dedicated time for meetings, for preparation. So this notion that home-based work will somehow take care of the care responsibilities, I think is fundamentally something that I'm trying to place as as a thought that needs to be challenged. And I think it cannot be the only solution. That can be part of a bouquet of solutions that we need to look at. So in terms of, when I said that one size fits all does not work, what does that mean then? Because we're typically used to thinking of, let's think of a model. Now that there is a lot of conversation about care economy, care models, we tend to think about developing one, best model and then say that, okay, we'll tweak it. What we are saying is that this thing needs to be turned on its head, and we assume that there will be no one size fits all, but we look at principles. Can we arrive at certain principles that have to be adhered to? In fact, the work that we are doing with UN Women right now, looking at, Indian, global, and regional models, is around this kind of a thinking. For instance, we need to say that, okay, there has to be a element of affordability. There has to be an element of quality standards, whether it is the space in which these centers are run, the ratio of worker to whether it is children, elder, or it is the persons with disability. What about qualified workers? So some principles is something that we need to arrive at, and then say that, okay, if these principles are being met, then this is something that will work for a set of people. The second thing that we, as a lot of work, and as particularly, I think those of us who work with qualitative, women's groups and women's qualitative studies and women's group, we say that everything is context specific. So, and as Isha ma'am had said, that what we really need to do is to listen to the women. And so can we have, and I think this has also been said by other panelists, that can we have systems whereby we allow for collectives of women who need care, are going to be using the care services, and that could be, sometimes it could be men also. If men are engaged in care services, even they should be there. But primarily we know it is women. So their collective should be part of design, planning, implementation, monitoring, and build that into governance and accountability systems. Because I think when you have a voice, as she very clearly said, that when you look at the ground and the people who are using it, and they are the ones best people to tell you what needs to change and how it can change, and they can actually give you suggestions as well. Finally, I think my fourth suggestion would be that we need to do a lot of work on norm changing. Today, if a woman wants to say that I'm going to put my child into a care service, she is going to start having to convince somebody or the other who's likely to have a judgment about it that she is not a woman enough. She's not a good woman enough. And how can she think of, how does she have no love? Does she have no care? And I think we need to change this mindset. And that investment will not it'll become a chicken and egg story, because you may have come up with the best models, but if women are not going to use it, then you're going to say that, see, we are providing but women are not using, therefore nobody's going to take care of it. Either they become very poor quality, or they might just stop. So I think these things need to go hand in hand to say that children, elderly, persons with disabilities are all responsibility of the society. And therefore, it is the society's responsibility to say how we can provide these services. And they are good. If they are good quality services, people will use it. They are easy to access. People will use it. So these things have to go hand in hand. Thank you.
Thank you so much. I'll come to Rituraj next, but before doing that, I just wanted to say Elizabeth, Henashri, Harishankar Raut, all really good points. A lot of systemic issues that are being raised here in the question and answer box, and I think the general everyone can't see it, but I'm just reading out from that. And we have to have many more discussions like this to address some of these larger issues of what is the appropriate policy framework, how do you bring in the whole issue of climate resilience into these current conversations. So I won't place the burden of answering all of this on my panelists at present. So Rituraj, if you could just take a couple of minutes. I know Janvi has so a couple of minutes, and then Harshil, and last Geetha, and then we can close.
Thanks, Mukta, again. So I think we have got very concrete suggestions for, decision makers. So what I would like to propose, I would like to propose three very concrete interventions based on, our experience working with, waste pickers directly and listening to waste picker themselves. So first, I think we need recognition, which we always push for, and, that comes along with space allocation for decentralized sorting to be mandated in master plans and urban infrastructure design. So this means, again, establishing MRFs, which is material recovery facilities with waste picker participation, and I'm not talking about high-tech solutions or waste processing plants, but basic designated spaces where waste pickers can actually safely sort and store the materials they collect. So the spaces again need other amenities like basic amenities like water, sanitation facilities, first aid kits, and secure storage facilities for the waste they collect. And this all can be again integrated into the municipal logistics, say transportation or collection systems. So for example, ensuring waste pickers access to dhalaus, which is a segregation space with concrete space allocation, like specifically 60 square feet per person, which should be read alongside the current master plan norm of one dhalau, which is I think one dhalau 100 square meters for every neighborhood of 10,000 population. So additionally, we along with this, we also need allocation of 50 square meters in neighborhood parks for weight waste composting activities. And secondly, we need we again need, which again waste pickers talk a lot about, is an ID system or a service access system for them that recognizes across departments and service providers. So basically this isn't again just recognition solely, but then it's about connecting them to the healthcare, specifically addresses occupational hazards, and again financial services, and social security benefits. And the third, I think this is probably the most important for long-term change. And we need what I would like to call an urban commons policy framework for waste resource rights, basically right to waste. So this means again, establishing legal protection for waste pickers, their right to waste, right to access recyclable materials, and again, creating, municipal guidelines that allocate these rights formally, and ensuring that, there are waste picker representations in the decision-making process. So the bottom line is basically, integrating waste pickers into the urban infrastructure planning, and then we can talk about smart urban governance, that then sustainability outcomes. So I think, and that's a principle we can apply across all informal worker groups we are discussing today. And we have to understand that cities work because these workers work, and now we need to think about make our cities work for them too. So I'll end here, but really these are starting points. Again, there's so much more to discuss around implementation, local innovations, and how we shift these systems meaningfully. Thank you.
Thank you, Rituraj. I really appreciate how all the panelists are trying to densely pack a lot into the few minutes that they have. Harshil, I know that Janhavi, you have to leave. Thank you for being here. And even if you're not there for the end, let me just thank you before. And let me move on to Harshil next. Yeah.
Yeah.
Thank you.
Bye-bye. Maybe I'll just say, how can government actually implement things? For that, we need data. One good thing that came out of COVID was the situation that government understood they don't know how many workers or unorganized workers are there in our country. We need to have some sort of data. So my first suggestion is get all the workers registered, and government is doing great work in that. If we have right now over 31 crore workers registered, we are at a better stage. Even if that workers are not given any benefits right now, it's still a great stage to be in. If any crisis comes, we can actually help them. Ministry of Labor and Employment is taking some good efforts to actually use that data. Now, how to interlink that data with some other data sets that our country has, maybe form a sort of a family ID that some states are doing, linking it to PDS, linking it to other death registry, birth registry. Interlinkages of these data is absolutely important, so that any welfare or benefit scheme that have to be created, they are wholeheartedly created for a family. One is that parametric insurance, I've already said. And one last thing I really wish we have across states, across every city, are these migrant relief centers at every big railway stations and bus depots, a place where workers who are coming, leaving all their baggages behind, come at a place where their ration cards, where Aadhaar updation, bank account creation, POCWR card, e-shram card, whatever documents they want to get done, they are done at one place. A person like you or me, we face so many difficulties in doing, updating one of our ID cards. These workers don't have those verifications or ID cards, and this actually stops them from taking any benefits that the government has. So this migrant relief center is something that really needs to come in these cities in the planning stage at all. So this is something I would really recommend. If this can be taken forward, nothing like it. So yeah, I'll keep it very short.
Thank you. So I'll come to Geetha right at the end. There's been a thread of, the problems that women face, and I'd just like you to respond to anything that struck you at this webinar, and if you could just recap a couple of solutions that cities should really think seriously about.
I have not followed all of the responses that have come, but there was a question about LCs, and yes, Jagori has been studying this whole question of LCs and their implementation, and the recommendations should be ready very soon on that. Jagori has also been studying about occupational health of domestic workers, and that's another area that we intend to take forward, particularly in the domestic workers law. That's in the that we hope will come up very soon. And we really hope that this, the coalitions of domestic workers that exist in the city and beyond, we do hope that their voices do come together to address this whole question of the law and how that addresses better wages, bonus, insurance, leaves, all of that, leading to better working conditions for domestic workers, their recognition as workers in the first place, both by society and by themselves. Also, in the question, I think many of the questions about infrastructure have actually resonated throughout across the thing. And what I really liked was what Aishwarya said about the city being planned with workers in mind. that workers are part of this city, and therefore how can they be easily accessible to their employers? How can they have rest? And you asked me to talk about what the women said, and I went back to my team. As you know, I've just come in, and so I went back to my team and said, "What did they say? Really, tell me one thing that they said." And she said, "Unko aaram chahiye." And you're like, really? I said, like that was a question which really struck me, and said, where do we even consider the possibility of aram for domestic workers, like that. So really, yes, how do we really listen to them? And so one of the suggestions that we have is really to conduct participatory safety audits where they become a part of the solution themselves also. And there are many other things that, already people have said, so I'm not going to repeat everything again.
Sure.
Thank you so
Thank
much.
you very much. So, I mean, that's a great place to stop, because ye aram and the question of rest and the question of how many hours to work and what does that mean for productivity is a question that everybody is asking. The corporate worker is asking it, the informal worker is asking it, and it's a larger question that we must address as a society. But it's been really exceptional. All the questions and suggestions, we've noted them down as ideas for future engagements, as well as the report that we will prepare from this. This has really been great. And to those who were here as attendees, it's impossible to answer everything, but all of your questions are seeds for future thoughts and conversations. So please stay engaged. And with that, I'll hand it over to Abhishika to conclude.
Thank you, Mukta, and thank you all the panelists for your insightful comments and suggestions, and also the solutions all together. Now, I would like to invite Kanu Pradhan to deliver the closing remarks.
Good afternoon, everyone. Thank you very much for staying with us throughout this deeply engaging and insightful discussion. So the objective of this webinar was slightly go beyond the binary formal informal kind of distinction, and we wanted to understand the needs, challenges of vulnerable urban workers at a more sectoral and occupational levels. Even though we focused on a selected group of workers today, we acknowledge that we have many more different types of workers exist in urban India. Also, we understand that there is a large diversity within each of these groups, so we cannot consider them as one set of problems. There will be many layers of issues. So all our speakers, I think, shared rich insights into the needs of different occupational groups, along with some possible suggestions. So I am not going to repeat everything. I think I will just highlight 2-3 points I could understood big points from this discussion. These are very broad at a much broader level. The first is all the challenges or needs we are talking about. We can at least classify them into different types. One is some of them are very sector specific. So construction ban or safety concern are at the construction sites, or we can say even charging points. These are very sector specific issues. Then we have some common issues. I think all our experts have talked about infrastructure, whether it is resting place, sanitation, water. So it affects different types of workers. So whenever we think about solution, I think it will be based on the nature of challenges we are talking about. Then I think in all this discussion, we find gender is a extra layer. Women face an extra layer of vulnerability. Sometimes there is a sector-specific issues. Then there is a broader systemic issues. And I think one point which came from Harshil's discussion points is construction is a shared problem across all these groups, whether it is care work, gig works, construction, domestic. I think all these sectors are heavily dominated by construction workers. And these people face various difficulties in accessing social benefits due to various reasons, whether it is documentation, language, or any kind of systems. All our So this issue would be useful to understand how we can plan our city or policies to improve the livelihood of informal workers. Each of our experts, I think, provided like many suggestions. Mapping those suggestions into various stakeholders is very important. I think accountability is something useful. Also, the role of civil society organization, NGO, is also something important. So I think we have already crossed our specified time. On behalf of the CSUL and NIUA, I would like to thank everyone who made this webinar possible and successful. First, our heartfelt thank to Isha Ma'am, Joint Secretary MoHUA, for her time and graciously addressing the session. We also gratefully thank to officials from MoHUA and other and both NMUs for their participation and consistent support. We also thank Dr. Kundu, Director of NIUA, for our opening remarks and continued leadership. A special thanks to all panelists, Aishwarya ji, Harshil ji, Geetha ji, Janhavi ji, Rituraj for sharing your knowledge, experience, and suggestions. And to all our participants, I think thank you very much for your interest and involvement, as well as your insightful questions. We hope you find this session useful and look forward to see you in our future episodes. Finally, I think I would like to thank all our CSUL team members, especially Mukta and Abhishika, to organizing this webinar successfully. Finally, I think I would say we had some technical glitches from our side. Because of that, some participants could not join. We are very, very sorry for that. We'll try to take in that account in our future series. With that, I think I will hand over to Abhishika.
Thank you, everyone. I hope it was really interesting for everyone to join and have such an insightful discussion. We will be having more such episodes in future, and I hope everyone can join future sessions and webinars and participate as we did today. Thank you, everyone.